Hey guys, this is Brandon. I had my microdiscectomy for my L5S1 today. Hopefully you guys can see me pretty well. I'm actually wearing like an old work shirt, so trying to hide like my logo. But yeah, so I just wanted to make this video because I've had so many opportunities to see other people's videos that have had this procedure, and I've just learned so much, good and bad, what to do, what not to do, just according to their personal stories collectively. The purpose of this video is to kind of explain a little bit, once again, just a quick summary of how I got into this, what led me to surgery, and then just my results so far, one day out from surgery, because it happened at 8 a.m. this morning. So yeah, so as I said in other videos, it just started out as like back trauma, work related, and just kind of started growing over the course of time into like this pain down my sciatic nerve in my left leg that left me like limping, and I couldn't sit, couldn't bend, like nothing. It was just like really hindering for the type of activities that I do and who I am. So I refused or turned down the surgery the first time because I was like, I want to try everything. And the epidural injection really helped for like 4 months. And then it started wearing off. And that time I was doing physical therapy, pool therapy, acupuncture, electric therapy, stretching as much as I could, just kind of everything. And basically led up to a point where like I had to go on medical leave, and I was in pain every day on the ground. Just a lot of crazy stuff. And so yeah, there was a kind of point where I was just like, you know what, I've tried everything, even a second steroid injection that didn't work, it failed. And I was like, I can't live like this anymore. So I did my research, I checked with a lot of people, I did stuff, and I decided to go with surgery. So I worked with sports and spine orthopedic in Torrance, because I was in Carson at the time. Since then I've moved back to Corona to try and heal and to, trying to cover up that logo, and to try and just regain a sense of stability. So this morning I had it. It was like 8 a.m. Torrance. We drove all the way out there at like 5 in the morning. Traffic. And yeah, so it was kind of scary. I was fasting, so I was like, when I fast and I get nervous, I just kind of like get nauseous. But they took me in, put the IV in. The team was very sweet to me, like very personal. I met the anesthesiologist, I met the nurses, I met the doctor again, I met just basically everyone that was going to be there for it. And it kind of set my mind at ease. So after using the restroom one more time, yeah, I had the IV in, and yeah, they basically, unfortunately, like a day or so two before, I contracted swimmer's ear. So I had this like earache, and I was nervous that they were going to postpone it, and thankfully they didn't, because it wasn't that bad. But I was also going in with that, so it like sucked. And so I get wheeled in. It's a very bright room, really cool. I'm very jokey the whole time because that's just how I am. And then, yeah, and then before I knew it, I was just waking up. And the first thing I noticed was just that like my back was like stiff, and that I was groggy. My throat hurt a little bit from the tube, but it was okay. And yeah, I was just laying there, and it was funny because I could still feel some tingling and numbness on my left leg. Prior issue is that I had like pain all the way like down, and it went all the way down to like the toes, like my left two toes, and it was just pretty bad. But yeah, it was just kind of like a light tingling and numbness, and it took forever for me to get out because they have to make sure you can pee before you leave, and I was just having trouble. But they fed me, I took an oxycodone, and then I was ready to go. Hour and a half traffic home. I've been icing. I have the brace on. If you can see like that cool thing right there, my dog. So it kind of like helps keep me very in line, and I even have my little warrior headband. But yeah, so I've just been noticing that I can actually sit down right now without feeling any pain. So weird. I feel like I almost cried, and I feel like I've seen other people's stories like that. my mom has a lot of back issues too, and I think I've also kind of inspired her to think about it. So that's pretty cool. But yeah, so when I walk, I don't have a limp. A lot of the pain is just the incision. So just the area that they like went, pulled my muscles to the side and just kind of um, did the thing. Look it up, microdiscectomy. You'll see like the whole process. And so that's just the worst pain. But I've practiced getting in and out of bed, and I have a claw grabber, thankfully. And my mom and Jeremy have just been so helpful. So I don't know what I would do without them. It's just a good choice to have people with you, because you can only do so much by yourself. If you don't live with anyone, at least get someone to come help every now and then. And like what I did before this whole surgery is I put everything like my level, made like a little area with all my toiletries and all that, and I put out clothes so I could just pick them with my picker. And yeah, just honestly do everything you can to follow the directions for that whole time. You know, wear the brace, do the ice, get up and walk the amount you're supposed to. The first day's kind of like, because you have anesthesia, but you can do it. I'm 30, I just turned 30 last week, and to have to go through this is just so traumatizing, but I'm doing it, and I believe you can do it if that's what you choose. Everyone has different results, you know. Don't look at mine as a cookie cutter experience, because, you know, mine was going on for a year, and I just put it off and tried everything. Try everything first, that's first and foremost. But yeah, I'm gonna try and keep this going with like a 6 month, or no, I cut like 1 week, 1 month, you know, that kind of time increment to kind of keep you guys updated and to kind of try and inspire people to really consider their options. So yeah, so keep looking out. Thank you for everyone that supported me with prayers and good vibes. Sorry, my throat's a little tired. But yeah, just keep an eye out, and we're gonna get through this. Oh my god, this work shirt, I swear. It's just so comfortable. Okay.